Welcome to Thursday's edition of COVID-19. I'm Min Sun-hee. There appears to be a steady rise in daily cases in the country, stemming from small gatherings, workplaces, and even schools, along with cluster infections at care centers for the elderly. Now, given this scenario, some are floating the idea yet again of herd immunity. We have more on that later on the program. Here first, Kwon So-ah with the latest numbers on the pandemic. So let's begin with the situation here in Korea for this Thursday.
Yes, Sunny, we have a slight uptick in infections this Thursday, meaning triple digits once again. So let's get right into the details. We have 125 new infections, which raises the total to 26,271. The death toll stands at 462. We have 29 more people in quarantine compared to yesterday and 95 new recoveries. So for the second straight day, we are seeing an increase in cases. And compared to yesterday, we also have 10 more domestic transmissions. So let's take a look at where the new cases broke out. Now, 106 cases were domestic infections, so above 100. And we have the highest number in Gyeonggi-do province at 58 new infections. And here in the capital, Seoul, with 36 new cases. This is the highest number in a month that we are seeing. Also 7 over there in Gangwon-do province, and sporadic cluster infections in other parts of the country. We are seeing this rise here because we have new outbreaks as well as additional cases of existing cluster infections. Now, while the nation has been under the lowest out of its 3-tier social distancing guidelines since October 12th, we are still seeing more than 50 domestic infections in recent days, including this Thursday, which is raising questions regarding the appropriate level of social distancing measures. And regarding that, the government is expected to make a revision to its 3-tier scheme on November 1st.
I see. So meanwhile, on the international front, French President Emmanuel Macron has announced a second national lockdown, I hear.
Right, Sunny. So that will begin on Friday and is expected to be in effect until at least the end of November, which means that essential, non-essential businesses will close and people are asked to be working from home, but schools are kept open. Now, Macron warned of the country being overwhelmed by the second wave of the coronavirus, which will be harder than the first. And in fact, France is the country with the 5th highest number of infections around the world, with 36,000 new cases added in the span of a day. And the US had over 82,000 new infections. And as predicted yesterday, India has surpassed 8 million cases. And over here in Mexico, we have over 900,000 cases. So all top 10 here now have over 900,000 infections. And if we move over to other places now, another spot up here, Italy has become the country with the 13th highest number of cases. And we also have a concern over in Indonesia here, which surpassed the 400,000 mark. And in total, the world has over 44.7 million cases with almost 1.2 million fatalities. And those are the updates I have for now, but I'll be back with more after the government briefing. Back to you, Sunny.
All right, so thank you for that. Meanwhile, on the economic front, figures for the third quarter show a slight rebound in Korea's economy. For more, I have our Yoon Jung-min here in the studio with me. Welcome, Jung-min. It's been a while.
Hello, Sunny.
Right, so according to the latest data, Korea's economy grew at a modest rate in the third quarter. Tell us more.
Sure, Sunny. So the economy posted a sharp rebound from the grim figures in the third quarter in the first half of this year in the aftermath of the COVID-19 outbreak. The Bank of Korea released its preliminary figures this week, which shows the Korean economy has grew 1.9% on quarter in the July to September period. Now, just to remind you, Korea's GDP fell over 1% in the first quarter and over 3% in the second quarter. The second quarter figure was the lowest in more than a decade since the global financial crisis in 2008. The rebound in Q3, however, was also attributed to base effects, meaning that figures were so low in the second quarter to begin with that Q3 numbers had nowhere else to go but up. Despite all that, experts say it's an encouraging sign, and the government is confident that the economy will continue to mend itself in the coming months. Take a listen.
Growth has rebounded on the back of exports, and the economy is on a firm recovery track, which gives us hope that we can overcome this crisis.
The finance minister's third quarter growth may have even topped the 2% mark had there not been a spike in local COVID-19 transmission in August. Korean exports also picked up in Q3 on the back of automobile and semiconductor shipments. Imports also rose, fueled by rising demand for crude oil and chemical products. One area of concern, however, was consumer spending, which fell slightly in the third quarter.
I see. Seongmin, how are other countries faring?
Sunny, so the signs of a recovery are also being seen elsewhere. China's economy has continued to recover from the impact of the coronavirus for the second straight quarter. Beijing's Statistics Bureau said China's economy expanded 4.9% in the third quarter. Chinese economists had earlier projected a GDP growth of over 5%. Although its economy is firmly back on the growth trajectory, the pace has been slower than expected due to signs of slack in domestic demand. Also, uncertainty is on the rise once again, with many countries struggling to control the pandemic amid the ongoing second wave.
The GDP growth has returned to the positive territory in the first three quarters, but the international environment is still complex and grim with instabilities and uncertainties.
In the first quarter, China's GDP contracted 6.8% when factories across the nation were temporarily shut down to curb the pandemic. But China's economy quickly got back on its feet, rebounding by over 3% in the second quarter.
I hear we're still waiting for numbers for the U.S. economy, though, right? They have yet to be released.
It is, Sunny. So the U.S. Commerce Department is about to release the latest figures for the third quarter in just coming hours. But market watchers are forecasting a huge rebound in the world's largest economy. CNBC says U.S. GDP is expected to grow 30% or more at an annualized rate in the third quarter. It warned, however, that the crisis was far from over when the pandemic still raging on and over 12 million Americans remaining unemployed. The U.S. economy posted a staggering 31% decline in annualized growth from April to June. The glowing CNBC's forecast cited the recovery of 4 million jobs during Q3, as well as rising home sales and more consumer spending. The figure is set to be released only a few days before the U.S. presidential election, so it looks to have some impact on the voters' decision as well.
Right. Seongmin, I'm supposing that the pandemic continues to pose a threat to the global economy then?
Yes, you're right. So the second wave of the pandemic appears to be well underway in the U.S. and Europe, where tens of thousands of new COVID-19 cases are being reported on a daily basis. So we're not out of woods yet. And if the resurgence continues at this pace, it could jeopardize economic recovery in the fourth quarter. It's no exaggeration to say that the prospects of economic recovery hinge on how successfully the virus can be contained.
I see. All right, Seongmin, thank you for that. I hope to see you again soon.
My pleasure.
Right, it's time now for the regular afternoon briefing on COVID-19 here in Korea for this Thursday. Amid persistent cluster infections, authorities are yet again reiterating the importance of face masks and social distancing when within confined and crowded places. Officials are also urging for the proper ventilation of indoor spaces and the frequent disinfection of commonly touched surfaces. Now, these calls for safety come amid the launch of discount vouchers to revive the hospitality industry, which has been especially hard hit by COVID-19 restrictions. Authorities are emphasizing the need for simple personal protection measures to allow for continued social activities that ensure a sense of normality to ward off the fatigue that is plaguing the public amid the prolonged fight against the pandemic. I believe the briefing is about to start. We'll come back to you afterwards.
먼저 이상원 단장의 설명이
First of all, we
있겠습니다.
have Mr. Lee Sang-won with the explanation.
코로나19 감염증 국내 발생 현황을
Let us now begin our regular briefing
말씀드리겠습니다.
on the COVID-19 situation here in
10월
South
29일
Korea.
기준으로
As of October
국내 발생
29th,
신규
we have
확진자는
106 new local infections
해외 유입 사례는
and a total of
19명이
19
확인되어
new imported cases.
현재까지
The total caseload now
누적
stands at
확진자 수는
26,271.
현재는
Currently, we have
1,641
people in quarantine undergoing treatment, and 53 of them are patients with severe or critical conditions. Yesterday, we had one additional fatality, and the accumulated death toll now stands at 462. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the updates of major domestic infections by region, starting in Seoul City. In relation to the Gangnam-gu District Lucky Sauna, we have the first index case being confirmed earlier this month, and we have 16 additional cases being confirmed. The total now stands at 17. And in Seoul's Yongsan-gu district, in relation to a fashion company, we have also identified one additional case. The total cases now stands at 9. And in Gurogu district, in relation to a family there, we also have found that one additional person has been confirmed. In total, we have 44 cases being confirmed to date. And in Gangnam and Seocho area, we also have a social gathering. In relation to this gathering, we have one additional case, increasing the total to 30. And in Gyeonggi-do Province, Pocheon City, in relation to a high school, we also have the first index case being confirmed on 26th of October, and we have 14 additional cases being confirmed. A total of 15 have been confirmed to date. And in Gyeonggi-do Province, Yongin City, in relation to an alumni golf group outing, we have 9 additional patients being confirmed. In total, we have 51 patients being confirmed to date. And in Gyeonggi-do Province, in relation to an Yeoju City, a welfare facility for the disabled, we have 3 additional cases, and a total of 35 have been confirmed to date. And also in Gyeonggi-do Province, in relation to the Haengbokke nursing home in Namyangju City, we also have 1 additional case. A total of 72 have been confirmed to date. And also in Gyeonggi-do Province, in relation to Bundang Middle School in Seongnam City, we have 5 additional cases, increasing the total to 13. And in Gwangju City, Gyeonggi-do Province, in relation to the SRC Rehabilitation Hospital, we have 3 additional cases being confirmed. A total of 141 people have been confirmed to date. And in relation to Gangwon-do Province family gathering in Wonju City, we have 7 additional cases being confirmed. In total, we have 33 cases being confirmed to date. And in Daegu City, we have the Jesus Central Church. We also have found that 9 additional cases have been confirmed, and a total of 10 have been confirmed to date. As for other cluster infections, if you have any further inquiries, please make your inquiry to the spokesperson's office. And as of 29th October, we have seen the trends of the outbreak for the past 2 weeks. In the central capital area, we are seeing continued outbreaks, including Seoul City, Gyeonggi-do Province, and Incheon, taking about 68.5% of the total cases. And as sources of infection, we have seen that 30.2% were related to nursing hospitals and other healthcare centers for the seniors. And also we had small gatherings which are about 27.5% and also 13% or so stemming from the imported cases. We also have about 11.9% stemming from the contacts with the previous confirmed cases, and we have about 10% of other cases which are under investigation. Currently, we are witnessing increasing of the trend stemming from the health centers for the elderly, and we also see an increase lately in the number of domestic cluster infections at regions. And this is why the central headquarters will also cooperating with the metropolitan area. We have also tested about 160,000 people who are working and using these healthcare centers in the area. And a total of 55,000 people have been tested, and we have tested one person being positive. And as for this person, we are conducting continued testings, and we have seen no further transmissions of the virus. And in Busan City as well, we have seen the vulnerable facilities witnessing cluster infections. We are continuing our testings there, and about 23,000 people have been completed the testings, and we also carried out disinfection measures accordingly. And right now we are enjoying a very good autumn weather, and we believe that many people are enjoying outings, and we also have high risks of infection stemming from a possible Halloween weekend. And if you are going outside and heading outdoors, please wear your face mask at all times, and also abide by social distancing measures. And after going to these gatherings and after traveling, if you visit the healthcare centers for the elderly, you could also transmit the virus for others. So please get yourself tested before you visit these centers.
네, 그럼 지금부터 기자님들과 질의응답 시간 갖겠습니다.
Right, that was Lee Sang-won from the Central Disease Control Headquarters with us this afternoon briefing. So what did he have to say?
Well, let's start with a 2-week assessment of the coronavirus situation here in the country. A little less than 70% of infections we saw in the past 2 weeks occurred in the metropolitan region, which means in the capital Seoul, nearby Gyeonggi-do province and Incheon. And over 30%, I believe, were related to nursing homes and nursing facilities. So really a large proportion and a rising trend we're seeing at such facilities. That as well as community spreads linked to small gatherings. And speaking of the nursing homes and other hospitals, medical facilities, the government is still underway with its massive screenings at such risk-prone medical facilities. And so far, out of the some 16,000 people that they are currently testing, only one person tested positive. Meanwhile, we have 53 people who are currently in serious to critical condition, and so we have many more new cluster infections, for instance, in the capital Seoul related to a sauna and also a company and small gatherings. So we are still seeing new cluster infections day by day, as well as additional cases linked to existing clusters, such as in Gyeonggi-do province related to a golf meeting, where the total now stands at 51, and also some welfare facilities, rehabilitation facilities, and nursing homes as well. This is why the official stressed for the nation's people to abide by social distancing, especially with the nice autumn weather. And we also have Halloween coming up, of course, this weekend. So we have to remain vigilant.
Right. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, also on the local front, we've heard about taking a ride in a car, but imagine taking a ride in a plane, because that is precisely what airline companies are offering to stay literally in the air amid what experts are calling the worst financial climate for the industry as a whole. And this is just one of many innovative ideas. Do take a look.
Incheon International Airport is the country's main air hub for passengers flying into and out of Korea. The airport has been quiet for the most part amid the COVID-19 outbreak, but it is now showing some signs of new life.
목적지 없는 여행이고요. 2시간 뒤에 다시 인천으로 돌아옵니다.
1월에 한번 해외여행 갔다가 그 뒤로 계속 못 가고 있었으니까 그냥 기본이라도 내보려고 오늘 한번 타러 왔거든요.
One local air carrier is now offering flights that take passengers on a flyover of Korea. A small consolation for those wanting to travel abroad, which has become next to impossible due to COVID-19.
저도 오늘 오랜만에 여행에 설렘 가득한 승객분들 보니 참 만감이 교차하는 하루였던 것 같습니다.
This particular flight is a little over 2 hours long, with seats in business class going for around $260.
빨리 이 코로나 종식이 돼가지고 우리 국민들이 다 같이 자유스럽게 여행할 수 있는 그런 시간이 빨리 왔으면 좋겠습니다.
Air travel has plummeted amid COVID-19 due to the effects of global lockdowns and border closures. Most international air routes are now canceled or suspended dealing a devastating blow to the airline business.
1월부터 코로나19가 들어오면서 시작이 되면서 사실상 국제 노선이 사실상 초토화가 됐고요. 전체적으로 전년 대비 97.6%가 수요가 사라졌습니다. 하반기 매출 감소 규모를 8조 8천억 정도, 그러니까 95% 이상이 이제 셧다운되는 것으로 국내 업계는 예상을 하고 있고요.
The situation is no different overseas, and companies in the airline industry have each been left fighting for their own survival amid this unprecedented crisis. Desperate for revenues, a Taiwanese airline company began offering flyovers to Korea's Jeju Island starting in September. This flight to nowhere, which circles over Jeju Island for 20 minutes, was a big hit among travelers and was sold out in just 4 minutes.
그 설문조사에서 응답자의 한 80% 이상 되시는 분들이 코로나 이후에 한국을 관광 목적으로 방문하겠다라는 그런 결과가 있었고요. 이벤트적 요소를 가미해서 참여했던 현지 그 소비자들의 반응은 굉장히 좋았었고요.
One airliner began selling in-flight meals to comfort weary souls, while other companies have converted their passenger jets to cargo freighters to offset the sharp plunge in travel demand. Despite these efforts, the future of the aviation industry remains murkier than ever.
Internationally, we don't expect to get back to pre-COVID 2019 levels until 2024. So it's going to be a long, slow pull out of this hole. We're a big employer of people. We're a big source of connectivity of GDP for the globe, actually. So we badly need financial assistance to see us through the next 18 months to 2 years and get us back to a positive result.
Despite the immense challenges that lie before them, the airline industry is doing all it can to keep its head above the water, in the hopes that the skies will open up to them once again when the world eventually recovers from the COVID-19 pandemic.
많은 국내와 국내외 전문가들이 미리부터 예측해 준 대로 북반구의 미주와 유럽은 이미 대유행으로 접어들었습니다.
Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. It's scientifically and ethically problematic.
Debate has been reignited over herd immunity as a resurgence in the Northern Hemisphere forces restrictions in Europe and elsewhere amid efforts to revive the economy in the face of a pandemic. Accordingly, today we take a fresh look at the controversial strategy of herd immunity and more. Here in the studio, I have Professor Choi Young-jun from Hallym University. Welcome back, Professor Choi.
Thank you.
And I also have Professor Sarah Ok-shin from Korea University. Good to see you again, Professor Shin.
Pleasure to be here.
And joining our talk virtually is Professor Tom Britton from Stockholm University over in Sweden. Pleasure to have you with us, Professor Britton.
Thank you very much. I'm happy to be here.
Right. Professor Shin, the daily tally here in Korea has been moving back and forth between the double and triple digits in recent days. But on a more comforting note, the rate of untraceable cases has dropped to 11% from around 30% back in September. What are your thoughts on the pandemic situation here in Korea first?
Well, yeah, given that, the silent infection with untraceable cases are very difficult to control, and it poses a serious concern for quarantine authorities to effectively control the disease. The decrease in numbers of silent infections are definitely good signs and good thing for our authorities to effectively control the COVID-19. However, I want to point out that, 11% number of these silent infection it doesn't really give us a sense of relief yet. For us to be continuing with this step one of social distancing, I think the number has to go down below 5%. And we're still seeing small outbreaks in nursing homes and hospitals, elderly being infected. So we have to continue with the social distancing and preventive measures.
Right. And Professor Che, staying with what Professor Shin has just said, as part of efforts to prevent further outbreaks at these nursing centers and health care centers for the elderly, officials are conducting massive tests of staff members, health workers and visitors to these facilities. What are your thoughts on these efforts, and what remains a challenge to containment efforts at these centers, specifically for senior citizens here in the country?
So the purpose of screening is to find the cases early, to those who do not have the symptoms at all or even the very minimal symptoms, and by then to prevent the further transmission of the infections. So I think it is quite reasonable for the government to pursue on looking for the hidden infections, especially in the nursing homes, and these places are the place where most vulnerable people are. So I think it's quite reasonable, and it is quite timely at this moment, because we are at a drop of the cases at this point. So I think we have to see, but to conduct this investigation we might have to see some more of the clusters, maybe.
Right. Professor Britton, Europe is tackling a frightening resurgence in COVID-19 cases. What is the situation in Sweden like at the moment?
Well, as you probably know, we had a very tough spring with a lot of transmission and also case fatalities. Then, as in most other countries, it dropped during the summer. Now we are seeing a small rise, but not as rapid as in several other countries in Europe. But we are seeing a small rise. And the authorities, let me just stress that I'm an independent professor at the university, so I'm not a spokesman for the public health authorities. But they have imposed some local restrictions where there is extra high transmission right now. So in some parts of Sweden, they have added some restrictions, but nearly all our restrictions are voluntary, so they're not regulated, but they are recommendations. So I think that is the biggest difference between Sweden and other countries, that they have regulations, whereas we have recommendations.
I see. Professor Britton, so authorities in Sweden adopted a more relaxed approach with no lockdown and instead an emphasis on personal responsibility in the early stages of the pandemic amid hopes for herd immunity. And speaking of that, I understand that you estimate the level of immunity in Stockholm to stand at around 20% compared to just around 4% in Copenhagen and 2.3% in Oslo. Could you tell us more about your calculations?
Well, those numbers that you refer to are they contain a lot of uncertainty, but the relation between them is much less certain. So it could be that we only have 15 and Denmark 3 and Norway 1.5. That could very well be, but the relation between them is quite certain. And the simple reason for that is that if you just look at the number of case fatalities, it's obvious that we had much more transmission in Sweden during the spring. So for that reason, we have higher immunity now. But I would not say, and the public health authorities would not agree on that Sweden has been striving for herd immunity. Their ambition has been to reduce transmission, but not stop it. But they repeatedly they say we're not aiming for herd immunity.
I see. Meanwhile, Professor Shin, what are your thoughts on a herd immunity strategy over in the US? I mean, the president there has largely embraced the idea of letting the virus run its course, he says.
Well, I think it's very unfortunate that US White House officials have taken this approach. Given that some experts are saying that if they continue to do this, they might lose 1 to 2 million people in the US. And that's really catastrophic loss of human lives with no benefits for the society. So, as you know, imposing the herd immunity is not going to provide a protection for the elderly or vulnerable groups. And as far as the herd immunities, the concept of herd immunity is concerned, that the concept is that the herd immunity approach it's not depends on the unproven assumption that the people who survive the infection will become immune after infection. But we still don't have much of scientific understanding on the duration or the effectiveness of the immune response following COVID-19 infection. So I think the US government is taking a very dangerous approach with the defense against the COVID-19.
I see. Professor Che, given the prolonged battle against the pandemic here in the country as well, there are some who are, like I mentioned at the start, floating the idea of herd immunity. What is your stance on this issue?
So I think I agree with Professor Shin that the concept of herd immunity actually comes from the diseases that are preventable by the vaccine. So we have to assume there is a good vaccine that is effective and safe to be used before we even discuss about the herd immunity. And at this moment, we do not have any vaccines in our hands. Only 2 countries are using their national vaccines at their own countries, but it's not in other places. So I think it is quite early to say or extrapolate our findings from what we have seen for the COVID at this moment to calculate the herd immunity and then apply it to the COVID response strategy in our public health sector.
I see. Professor Britton, you mentioned earlier that the difference in Sweden is that authorities there are not putting restrictions in place but are making recommendations for the public. Could you please elaborate on those recommendations?
Well, for the moment, we are encouraged to adopt social distancing. That's the main thing. And when you have symptoms, you should test yourself and isolate yourself. And the elderly are recommended to, the 70 plus are recommended to stay more or less home the whole time and not socialize with others. So I guess those are the main, and also restaurants is now, they have to have quite a lot of distance between the seating, and also people are recommended to work from home rather than using public transport, so to avoid the congestion in public transport. So I guess these are the main recommendations that we have.
I see. Professor Britton, just out of curiosity, what is your opinion, or what in your view is the threshold for effective herd immunity? I mean, we've had the threshold of about 60% being floated around in the media in the early stages of the pandemic.
Okay, so this connects to my research. So here I think I know a little bit more. So it depends on how immunity is obtained. If it is obtained by vaccination, then I think probably 60% is a reasonable number. However, if the immunity comes from disease spreading, then the people that become immune are the ones that get infected. And in that situation, socially active people and highly susceptible people are overrepresented. So in a sense, the immunity is more efficiently distributed in the community, which reduces the threshold from around 60% to around 40 to 45%. I don't claim to know the exact numbers, but the big difference is that when immunity comes from disease spreading, it is distributed in a sense, in a way that the socially active people are overrepresented, which is not the case when you vaccinate people.
I see. And if you were to link that piece of information to the reality in Stockholm, would you say that Stockholm is getting closer to achieving that kind of immunity?
We are not close to herd immunity, and I think we will not reach it. We will reach it hopefully when the vaccine is available. Everyone wants herd immunity from vaccination, but maybe now in Stockholm region we have immunity 20%, and I think herd immunity is between 40 and 45. So I don't think we will reach it. I don't hope we will reach it. However, the immunity level that we have cost a lot of lives, which is very bad. Now it is slightly helping us in the sense that it does reduce spreading to some extent.
I see. Meanwhile, Professor Shin, on a slightly bright note, AstraZeneca's trial vaccines have reportedly noted a promising immune response within elderly patients. What are your prospects with regard to the presence of vaccines in the near future?
Well, as far as I know, they haven't really released the officially published data yet. and they haven't finished with the final stage of a large-scale clinical trial. So, but the AstraZeneca spokesman told the media that they have seen good immunogenicity in the young adults as well as the elderly. And that's a very good sign if they have seen the high immunogenicity in the elderly, because it'll give good protection. But we'll have to wait for the published data to really analyze the potential effectiveness of these vaccines. We already have about 40 vaccines in trials, and several of them are in final stage of the clinical trials. But the most important thing is that for any vaccines to be produced and distributed, the safety has to be the top priority. And it'll take some time to really carefully analyze, evaluate the safety and ensure that there's no harm when the vaccine is given to everyone.
Right. Professor Che, where does Korea stand in the race for a vaccine against COVID-19?
So in terms of R&D, we are a little behind from what everyone else are doing outside. There are around 40 vaccine candidates that are under development, like 10 or 11 are in the phase 3. Only one vaccine candidate in Korea is in the clinical trials. So I heard that there are a couple of more that are in the preclinical trial at this point. But on top of that, we have very good manufacturing and production capacity in South Korea. That is kind of good news that we have this very good the production facility to scale up. So I think we can go by the two tracks. We can continue the R&D, and on the bottom hand, we can collaborate with others just to join the. There's a coalition called COVAX, and we can join that, and then do the active collaboration with the outside the players.
Right, Professor Britton, I understand you have a question or two for your counterparts here in the studio. That would be Professor Shin and Professor Che.
Yes, so it concerns your way to deal with COVID. It seems to have been very successful. So what are your main recipes for this success? And the follow-up question is, are there things in retrospect that could have been done better, either reducing spreading even more or making life more normal, like for the common person?
Right, perhaps we could start with Professor Shin with the relative success.
Sure. So, there are several factors that may have contributed to the relative success of our quarantine system. First, from the very beginning of the COVID-19 pandemic, we have introduced this rapid diagnostic testing so that we can, screen fast. We can screen rapidly the people who are infected, and we can isolate them. So we've done very well with that. At government level, they have done very well with contact tracing, with the high-tech surveillance system, and they have introduced the self-isolation and zero tolerance policy. So that was very good, and they have done very well with communicating with the public. And personal level, I think that all of us have done so well with keeping up with social distancing and facial mask wearing. So I think this rigorous testing, contact tracing, and personal level quarantine measures have all contributed to the success of Korea's quarantine system.
Right. Meanwhile, Professor Che, what efforts could be enhanced to perhaps better contain the pandemic here in the country?
So I think I can pick a tail to the Professor Shi that we do have had enormous contact tracing activities in South Korea, and we have accumulated tons of data on that. But we haven't had a chance to really get into link the various big data all together and analyze to generate our evidence-based policy guiding. So I think those are the areas that we have to work more at this point.
Right. Professor Britton, over in Sweden, what is the public's response to the government's method of dealing with the pandemic?
Well, there has been some criticism for people wanting to put stronger measures and not restrictions, but rather regulations. So there is a minority of people wanting this, but I would still say that the vast majority are supporting the authorities in the way they are dealing with it. People are getting, I think this applies to all Europe, people are getting quite tired of the restrictions, even if we have had very mild ones, so we should not be that tired, but people are still tired. So they are happy that life is sort of normal, and I think very few people think we should put on very much stronger regulations right now. There are some, but not big groups, I think.
Right, exactly, Professor Britton. As he just mentioned, Professor Shin, there is the problem of pandemic fatigue, so to speak, and the Global Health Body has said that pandemic fatigue might actually reduce public participation in containment efforts because they are exhausted with the restrictions in place. Do you share this concern?
Yeah, sure. I think that, having this COVID-19 affecting everyday life, really have affected us and doing, normal things in our lives. So I think definitely I share the concern.
Are there ways to ease it? Because I'm sure my mom's complaining about having to stay at home all day.
Right. But I think we have to adjust to this new normal era, and then we have to prepare for this post-COVID-19 era and doing, having this social media, using social media to really connect with each other. And we're slowly, adjusting,
right.
I think.
Professor Britton, I was just wondering, here in Korea, as part of efforts to prevent a twindemic, authorities here are highlighting the importance of getting flu shots ahead of the winter season. Is this the case in Sweden?
I have not heard about that. So it's believed that it protects also for COVID-19. Is that the idea, or?
The idea is that to make sure that you reduce your chances of getting the flu. Because if you had the flu together with COVID-19, it might aggravate your chances of a proper health path, so to speak. So flu shots are not recommended over in Sweden then?
Flu shots are recommended, like always this time of year, for people, I think it's above 60 and some risk groups, but I have not heard of additional recommendations, but it could be my ignorance as well. I haven't heard about it.
Right, that's good enough. Professor Che, I was just wondering, there is still concern here about how to get your flu shot safely. What recommendations would you extend?
So we do have had some issues, safety issues with the flu shots lately, like about 2 or 3 weeks prior. So at this moment, we have had a good evidence from the epidemiological investigation and from the pharmaceutical investigation to test the safety of the influenza vaccines. We do have had these issues. It's kind of historical since 1970s. So during all these times, there's no evidence to support that influenza vaccine poses additional risk to your health, especially compared to the influenza virus itself. So I think it is very safe, still very safe practice to get the flu shots, especially if the person is at a high risk of certain age group or with a certain medical conditions.
Why are some health experts claiming that it's better to be well hydrated before your flu shot?
So I think it is just just saying. It's not from really from the medical background, but I think it is just to ease in the person before getting shot, to loosen yourself and not to get too afraid.
I see. Professor Britton, one final impromptu question for you. What is the response to face masks in Sweden? Has there been a shift in recommendations for wearing a mask, or do authorities still claim it's not that necessary?
Yeah, so they claim that it is not it's not one of the most important measures. In hospitals and elderly homes, of course, then people wear face mask and also this glass thing. But out in the streets, you see some people wearing face masks. 1 year ago, I had never seen anyone wearing a face mask except Asian tourists. But now you see some Swedish people wearing it. but still it is below 10%, and it's not highly recommended. It says that it's better to avoid congestion rather than be close to other with face masks. So they don't say it's bad, but they say it's better to avoid gatherings. That's the main.
Words of wisdom right there. All right, Professor Britton, thank you very much for answering my impromptu questions as well. Professor Shin, thank you for being with us today. And Professor Che, thank you for your time as well.
Thank you.
Right, on that note, we end Thursday's coverage of COVID-19. Cold spells here in Korea today until tomorrow, so do layer up before heading outdoors. Also, as always, thank you for watching and do tune in tomorrow at this hour.